Script of the video abstract of the subgroup analysis of Azuma patient and the INPULSIS trials of nintedanib in idiopathic pulmonary fibrosis for Respirology. My name is Professor Taniguchi from Tosei General Hospital, Aichi, Japan. I am pleased to present a summary of our paper recently published in Respirology entitled Subgroup Analysis of Azuma patients in the INPULSIS trials of nintedanib in idiopathic pulmonary fibrosis. Idiopathic pulmonary fibrosis, or IPF, is a rare disease characterized by progressive fibrosis of the lungs and loss of lung function. Nintedanib, an intracellular tyrosine kinase inhibitor, interferes with pathogenic pathways involved in IPF, including the proliferation, transformation, migration, and survival of fibroblasts, and the synthesis and deposition of extracellular matrix. The two duplicate international randomized double-blind placebo-controlled 52-week Phase III INPULSIS trials were designed to investigate the efficacy and safety of nintedanib 150 mg twice daily in patients with IPF. Patients were randomized 3-2 to receive nintedanib or placebo for 52 weeks, followed by a 4-week following period. The primary endpoint of both trials was the annual rate of decline in forced vital capacity, or FVC, a marker of disease progression in patients with IPF. The key secondary endpoint was time to first acute exacerbation and change from baseline in the total score of the St. George's Respiratory Questionnaire, or SGRQ, both over 52 weeks. Safety was assessed by the clinical and laboratory evaluation and the recording of adverse events. In both trials, nintedanib consistently slowed the progression of IPF by significantly reducing the annual rate of decline in FVC compared with placebo. Our paper presents the result of an important pre-specified subgroup analysis of the efficacy of nintedanib in Azuma patients and the INPULSIS trials. On the 1,061 patients who were treated in the INPULSIS trials, 322 were Asian and 608 were white. An Azuma patient, the adjusted annual rate of decline in FVC was minus 124.0 milliliters per year in the nintedanib group and minus 218.1 milliliters per year in the placebo group, a difference of 94.1 milliliters per year. The treatment effect of nintedanib on the annual rate of decline in FVC in Asian and white patients was similar and consistent with the overall population and the INPULSIS trials. The proportion of Asian patients with one or more acute exacerbations was 4.6% in the nintedanib group and 7.0% in the placebo group, and the hazard ratio for time to first acute exacerbation was 0.66. In Asian patient, the mean change from baseline in SGRQ total score was 2.25 in the nintedanib group and 4.16 in the placebo group, a difference of minus 1.91. The treatment effect of nintedanib on time to first acute exacerbation and change from baseline in SGRQ total score was similar in Asian and white patients and consistent with the overall population in the INPULSIS trials. The adverse event profile observed in Asian patients was as expected based on the adverse event reported in the overall population in the INPULSIS trials. In Asian patients, the most frequent adverse event in the nintedanib group was diarrhea, reported in 56.2% of patients in the nintedanib group versus 15.6% of patients in the placebo group. However, only 2.1% of Asian patients treated with nintedanib and none of the patients treated with placebo stopped treatment due to diarrhea. In conclusion, in pre-specified subgroup analysis of data from the INPULSIS trials, the treatment effect of nintedanib was similar between Asian and white patients. These findings further support the conclusion that nintedanib slows disease progression in the broad range of patients with IPF.